Okay, my name is Abby Whitford.
I'm Sarah Wesher.
I'm Chloe Clausen.
I'm Peyton Severson.
I'm Kylie Lund.
And I'm Grace Bradley.
And we are nursing students at Carroll University. And today we are going to be teaching you about compression-only CPR and how to use an AED.
So what is Project Adam? So Project Adam was initially started when Adam was a high schooler. After a basketball game, he collapsed unexpectedly, and he was he had a sudden cardiac arrest, and CPR was given immediately afterwards, but no AED was present. So he was not able to be resuscitated. And after this, Adam's parents started Project Adam, which the goal is to prevent cardiac arrest deaths in the community by educating schools and the rest of the community. So this is what we're doing today in his honor. And this is a video of what not to do.
We make it easy for you to get your taxes right, but we...
Oh.
Alright, so you saw what not to do, so we're going to test your knowledge on CPR. Should we just we would actually play it, but should we just let them read it right now? Like the questions for them?
Sure.
Here's this close, because then you can see it.
Okay, these are the questions that we're asking. Right?
You can click show answers. I don't even, are they even going to be able to read them?
Probably not.
Okay. So, what is it? What do you know about CPR? What is CPR? What does CPR stand for? Where do you place your hands when performing CPR? How many compressions per minute should you perform? Is that it?
Yes.
Okay, and that's the end of the pre-test.
So recognizing sudden cardiac arrest. So cardiac arrest is caused by tachycardia, which is an increased irregular heart rate. And the signs of these would be the victim being unconscious, not breathing, and not feeling a pulse. And Chloe will discuss this further later. But more about sudden cardiac arrest. So roughly about 350,000 people die because of this every single year. Suffer from this every single year, and only 10% live. And this is why we're trying to start this program and continue it, because we're hoping to get that 10% up higher. And then I would have asked, do you know anything else about, I would have asked that at the beginning, sorry. I would have asked at the beginning, do you know anything about sudden cardiac arrest? And then they would tell me what they know about it. And then the difference between sudden cardiac arrest and a heart attack. So sudden cardiac arrest is more of an electrical issue within the heart. As you can see by that diagram, it's just more arrhythmias. And with a heart attack, it's a plumbing issue due to a clot formed. So your heart can't get the proper blood pumping through it, and it also can affect the rest of your body.
Okay, so now we are going to learn how to perform proper chest compressions. So, the first thing that we want to make sure that we do before we do anything is make sure that our scene is safe. So that means that we want our victim to be lying on a flat, hard surface, and we want to make sure that they're not in an area of danger where they could get stepped on, or if they're sitting in a puddle of water, if you're at the park and they're sitting in wood chips. Those are not scenes where you would want to start performing CPR. We want to remember that the heart is really deep within the chest cavity, and it's really heavily protected. It's protected by your sternum, which is this bone right here, as well as your ribs. And this is because the heart is so important for us to be able to live our lives every single day. It does so much for our body. So we just want to keep that in mind. We want to make sure that when we're performing these compressions, we're pushing hard enough. It's going to feel weird, but we really have to push hard to get past that protection. For our adult victims, you want to push 2 inches deep. And a way for you to remember that is the length of 2 water bottle caps. These are 2 water bottle caps glued together. Our rate, so how fast we want to perform our chest compressions, is 100 to 120 compressions per minute. Some ways that you can remember that there are many songs that you can sing in your head. For example, Staying Alive, like you saw in that video. Baby Shark is another song that you can sing in your head. And there are many others too. And so when we actually perform our compressions, the way we want to do it is you want to push with our arms straight, with our hands on top of each other, and our top fingers locking over our bottom hand. And we want to make sure that we're pressing in the center of the chest, right here, right over that hard sternum bone that we talked about earlier. So you want to make sure you're at a good angle, your victim is on a hard surface, a flat surface. We take our hands, top hand crosses over, and we're pushing in the middle of the chest, and we're pushing 2 inches deep and singing Baby Shark, Staying Alive, whatever song you want, making sure our arms stay straight the entire time, like so. So, staying alive, like that. And how many rescuers are available to help? So the number of people that are at the scene with you will determine what you do to help your victim. So if you are the only person there and no one is there to help you, what you want to do is activate the emergency response, call 911, and grab your AED before you start any CPR. And you only want to grab that AED if it's nearby and you know where it is. You don't want to waste a ton of time looking around for an AED. Then the next thing you want to do is check for responsiveness and breathing. So to check for responsiveness, the way you do that is you tap on your victim's shoulders and you ask them, "Are you okay? Are you okay?" If there's no response, then they're unresponsive. And for checking for breathing, we want to look for that rise and fall in the chest. You can also listen for breathing around the mouth and feel if you can feel an exhale. If there is no response, when you ask them, "Are you okay?" and you don't see any signs of breathing, then that means that you need to perform CPR. You want to use your AED as soon as you possibly can, and we'll talk about using the AED in a few minutes. But you want to use your AED and then you want to start your chest compressions. And you want to continue that process of using the AED with your compressions until EMS arrives, and those are the medical professionals that come in an ambulance. If there are 2 rescuers available, then you do these steps, but in a slightly different order. So again, you want to check for that responsiveness and breathing, just like we already described. However, you're going to delegate some of these duties among the other responders. So, one responder is going to start those chest compressions, while the other one activates the emergency response, calls 911, and goes and gets the AED. Once your helper returns with the AED, you want to put those pads on and use it as soon as possible. And then begin your chest compressions again, exactly like we already explained, and continue doing that until medical professionals arrive.
Okay, so we talked about the AED a little bit with Chloe, but do any of you know what AED stands for? And it's the Automated External Defibrillator. I'd see if they knew. But an AED, like we talked about, you use it immediately once you get it. You'll know the steps in a minute with Grace. But a fun fact about the AED is that you can't harm the person. So once you get the AED and you put the pads on, the AED will walk you through the steps to administer a shock. And then it analyzes the heart rhythm to make sure that there is not one present so that it wouldn't hurt the person. And it will tell you that it's administering a shock. And then you continue chest compressions. And then you can usually find an AED near a first aid kit or a fire extinguisher, and there's a marked area with a lightning bolt.
Alright, so now how to use an AED. Like Peyton said, they're typically found by a fire extinguisher. So they're in like a little pack. Once you grab it, there will be voice prompts telling you what to do. So first you want to open the AED, and then you'll grab your 2 pads. So first, there'll be little diagrams on the pads telling you where to place it on the patient. So first, there's one showing on the right upper shoulder, so you'll want to place one here. And then next, you'll place one down here. So it'll be attached to the AED. What you want to do is it will tell you to take your hands off the patient. It will analyze for a heart rate and see if a shock is needed. It'll tell you that a shock is advised, so then you'll take your hands off, you'll press this red button on the AED, which will then administer a shock. After you administer the shock, you'll want to continue to perform your chest compressions for up to 2 minutes. After those 2 minutes are done, it will want to reanalyze the heart rate and see if a second shock is needed. If a second shock is needed, you'll want to do what you did before, take your hands off the patient and then press that red button to administer the shock. It's really important to make sure that you continue to do chest compressions until EMS arrives. And that's how you use an AED.
Okay, now let's see if you guys know how to put the steps of CPR in order. So we are still a little torn on how we're going to do this with the students, but we think we're just going to ask, like, does anybody know which of these steps comes first? And see if anybody is willing to, like, raise their hand or shout out an answer. We're gonna go through a few steps, possibly give them a minute or two to fill out the order that they think is correct. And then on the next slide, we will go over the correct answers. So now let's see if you were correct. First things first, we're going to assess the scene and safety. We want to make sure both you and the person who needs CPR are safe. Then you're going to call 911 for help and locate the nearest AED. Next, you're going to begin compressions, and you want to make sure you're pushing quickly and firmly, at least 2 inches deep in the middle of the chest with a rate of 100 to 120 beats per minute. Next, we're going to use the AED if it's present. You're going to apply it and perform CPR as the AED instructs. And then finally, you will keep performing CPR until the EMS arrives or you are unable to continue.
And then this is where we give them time to practice their chest compressions and things. I added a slide in here with like the steps to remember while they practice. So.
Okay.
And then we'll do post-test.
And then, then everybody takes a post-test. So yeah, these are the questions for the post-test. You got it.
Okay, so CPR stands for cardiopulmonary resuscitation. That's true. And then, where do you place your hands during CPR? Middle of the chest. You should perform 100 to 120 chest compressions per minute. That's true. And then, the technique used to clear a person's airway is lift chin up and tilt the head back. And then, when performing CPR, you should push with straight arms with your hand interlocked. That's true. And then what does an AED do? That is, it analyzes whether the person's heart is in cardiac arrest, and then it delivers shock. And then what is sudden cardiac arrest? That's unexpected loss of heart function, preventing blood and oxygen supply. And that's it.
Alright, and then we have a slide for questions if they have any. I think that's it, right?
Thanks for listening.
Okay.